Starting home health agency, home care in the state of Washington. You must choose at least 2 home health services in order to have your home health agency license approved in the state of Washington. As a home health agency license, you can also provide non-medical services. You can't provide services for counties you're not licensed for. So when you're submitting your application, you have to choose what counties you're going to serve, and you can only serve those counties. So it's not a statewide license. Different counties pay different rates for Medicaid. All right? The application fee for a home health agency in the state of Washington is $3,283 and $1,530 for the non-medical. That's the personal care agency. You must complete state-sponsored in-home services orientation class prior to submitting state licensing application. The purpose of the orientation, they said, is to provide you an overview of the state licensing process, explain the differences between home care, home health, and hospice services, which I have been reading to you all this time, an expectation they have from you to provide services to their vulnerable persons. Okay, you need both general liability and workers' comp insurance. For home health agency or home care agency, you will need an administrator, an alternative administrator. For home health agency, you will need an administrator, alternative administrator, clinical service director, and alternative clinical service director. That's the RN. Okay, you will have to buy policy and procedures specific to state home health agency, not Medicare. All right. After you have submitted your application, you have 9 months to complete any missing forms or any missing items. When your application is complete, the state will come out and they will tell you that they're coming for a survey. This is called announced survey. So they will tell you, hey, we're coming to do a survey for your agency to confirm that you're following the rules and regulations in the state laws, which is pretty cool, because unannounced means I'm just coming to show up anytime I want to. This one, they will call you and tell you. All right? The application is paper-based, not online. So the way I look at it, it's not a complicated state, straightforward. The fees are crazy, but the rate is pretty good. I found out that the home health agency, skilled nursing, the RN, the rate for the RN is $135. $135 per hour, $35.27 per hour for the RN services. That's on average, right? So 135, 134, because different counties pay differently. But anyway, most of the counties is $135 per hour for the RN services, the revenue code of 0551. All right, for the that's the visits. They also have private duty nursing, and their private duty nursing is almost $60 per hour. The difference between home health agency visits, they call it intermittent visits, and a private duty nursing is that private duty nursing is more than 1 hour. It could go for 24 hours, go for 8 hours. It's just a regular job. This intermittent visit is one visit. So you bill for one visit, not units. While the other one, you bill for units.